Good evening. I'm Dr. Lattanzi, radiation oncologist and also Deputy Mayor of Long Beach Township. I put together this short video to discuss a problem that was recently emphasized by our Governor of New Jersey regarding the issue of opioid narcotic abuse. I recently posted a rather lengthy article on my Facebook page in response to the Governor's State of the State address. I think it's very important that we all talk openly and honestly about what is an increasing problem of opioid abuse, not only in our community, but many communities across the country. The governor made a very impassioned plea regarding the problems of opioid abuse and how it leads to overdoses and ruining many lives in New Jersey. But there's several issues that I think that the governor needs to understand from the physician community and how it affects our community and our patients. I wanted to start by giving a history of the treatment of chronic pain, both in oncology and non-oncology patients. We are taught in medical school that to be very wary of giving narcotic pain medications to patients, as there was a significant risk to addiction and subsequent overdose. That dictum changed in the 1990s when pharmaceutical companies and several leading pain specialists described narcotic pain medications as underutilized, very effective medications, and essentially chastised the medical community for underdosing patients with pain. This led to many professional societies, including nursing as well as physician societies, to put an emphasis on managing chronic and acute pain, and even establish pain as the fifth vital sign, again demonstrating to physicians that we were not treating pain adequately. As one would expect, the use of narcotic pain medications has skyrocketed since 2000, and the number of opioid prescriptions is now technically out of control. What we have seen now is the governmental and these governing bodies now recognizing that this was probably a policy that was an error, that overprescribing narcotic pain medications, particularly in those patients with non-oncologic pain, may have many devastating effects. They have now taken what I would call the 180 turn and now are making drastic measures to try to reduce the use of opioid medications. This is truly a worthy goal, and I think the correct direction for us to take as a medical community. Unfortunately, the governor and the state legislature are putting together stopgap measures, and the CDC as well as the government now dictating that patients can only receive 3 days of medications. Ultimately, this may be the correct way to go, but unfortunately, implementing such a policy in such a quick fashion will have devastating effects. What has happened that with this governor and his subsequent attorney general, they are now also aggressively attacking primary care physicians for overprescribing medications. And what this has done is send a ripple effect through our primary care physician community. They are now so frightened to being sanctioned from these bodies for overprescribing medications that they have essentially shut down all of these patients. So all these patients now who have had chronic histories of long-term opioid abuse now find themselves in a difficult position. As one would expect, these patients now are chronically addicted to these medications, and they're being told from the governor's office that they should seek consultation with pain specialists. Again, a very worthy goal. However, what they fail to understand is that many of these pain specialists, first of all, are not available, and if they are available, they have little interest in taking care of these patients, as this is a difficult situation for them as well as the primary care physicians. What is happening, and what has been happening, is these patients seek out the next alternative, which is the underground of medications, i.e. Those sold on the street, and oftentimes heroin. Unfortunately, the heroin of today is now even more dangerous than the heroin of yesterday's, as it's now laced many times with a fentanyl or a fentanyl derivative. As we've seen, the heroin overdose rates are skyrocketing. They doubled in the last year from approximately 100,000 to 200,000 in Ocean County. And I suspect that the implementation of such draconian type of measures, both from the New Jersey Medical Examiners Board as well as the legislation that's coming from the governor's office and the legislature, this number will continue to skyrocket. A New England Journal of Medicine paper published in 2012 outlined this as an attempt to decrease the use of opioids in that one community resulted in many patients going to heroin, as they described it as being easier, cheaper, and more available. I fear that the government's intervention in such an abrupt manner will lead to such results in our county as well. I'm making a plea to both the New Jersey Board of Examiners as well as the Governor's Office and Legislature to reconsider this abrupt measure. We all want the goal of less opioid use. We believe that's a worthy goal, but this needs to be done in conjunction with our primary care physicians and those physicians who are in the community, not those physicians who sit in the medical school offices and those who sit on medical boards who don't have actual primary care practices. As far as I can tell, there's been no communication with our primary care brethren, and this needs to be an important part of finding the ultimate solution to the problem. In summary, I believe the governor's initiative has great merit. The goal of having less opioid use is certainly a worthy one, and we would fully support that. However, we need to recognize that this needs to be done in conjunction with our primary care community physicians. And if we can do so, we can gradually reduce that number. But taking a draconian effect and taking legislative actions is not the answer. I would urge all of you who consider this an important problem to contact your state legislatures and also the New Jersey Board of Medical Examiners and voice your opinions. Thank you.